Chapter 3, Intercultural Communication. So this chapter is going to talk a lot about intercultural communication, as the title says. As far as the communication goes, it does talk a lot about client-patient relationships and working with a healthcare provider. So if you're interested in going into healthcare, this will be very applicable to you. If you're not, I'm going to try my best to tweak it as far as nutrition goes so we can focus it on nutrition. But we may not cover all of it in as extensive detail as we're going to cover some of the other chapters, just because I don't feel that the content for all of this chapter is core to the learning objectives of the class. All right, so intercultural communication is absolutely necessary, and this is a skill that will allow you to communicate with a culture that is different than your own. It encompasses many things besides just the actual words that are said. It also includes gestures, postures, the space, how far away you're standing from somebody, how close you're standing to somebody. Are you in a group or are you individuals? And where are these conversations happening? What's the context, etc. Intercultural challenge. So there are some things that we can see from a culture just by looking at a person or see about a culture, and there are other things that we don't know. And so this is kind of going off of the you can't judge a book by its cover principle, but instead of using a book, we're actually using an iceberg as an analogy. And I don't know if you know much about icebergs, but here I'm drawing a very accurate and beautiful picture of the ocean. Icebergs generally have just a very small part out of the ocean that you can see, and a much more massive piece of ice is actually submerged underwater. So when we talk about the tip of the iceberg, we're talking about things that may be able to be seen, however, don't account for a big percentage of the overall picture. So when we look at somebody, we can possibly, not in all circumstances, but we can often derive something about what race they may be, their gender, their age, and even possibly their nationality, perhaps based on their dress or where you're seeing them. There are many things that we can't tell just by looking at somebody, and these things have to be learned through communication. And so this is the below the surface of the water, or this huge part of this iceberg. We can't look at somebody and know what their health condition is, what their occupation is, what their sexual preference is, what foods they eat, what foods they don't eat, how much money they have, etc. And so really getting to learn about people from different cultures in a in-depth level requires communication, and kind of getting below just the tip of this iceberg. People will rely on what their culture has taught them regarding expectations for cultural interactions. So, for example, when we wave hi, and when I say we, I mean people in the United States of America in general. When we wave hi to somebody, we generally expect them to wave hi back. When we reach out our hand for somebody to shake our hand, we expect them to put their hand out. When we smile at somebody, we probably expect them to smile back. But what we have learned in our culture isn't necessarily what other people are taught is normal in their culture. Also, social roles can vary based on cultures, and social roles can play a big part into how you communicate with people, as well as if you communicate at all, or what type of communication that would be. As you get to know somebody better, as relationships grow, usually the formalities between communications change. And so when you have known somebody for a longer period of time, you might be calling them by their first name. However, when you first meet somebody, maybe you're going to address them in a more formal manner, Mr. or Mrs. So-and-so, or Dr. So-and-so, or Professor so-and-so. Communication. So we're going to talk a lot about communication, but communication does not just mean the words. There are actually nonverbal messages and nonverbal actions within communication that play a significant role to the message that is portrayed from one person to another. There are two main components of the message. There is the content, which is usually the words or the nonverbal actions. And then there's the relationship between the speaker and the receiver. And this could be relationship as far as maybe there's a family relationship, mother to son. Maybe there's a social relationship. Maybe there's a professional relationship. Maybe there's even a governmental relationship, Vice President of the United States versus to the people of the United States. Verbal messages, actual words, can help to convey content. Nonverbal messages are better at communicating relationships. So if somebody is talking to another person and they're very close and they're laughing and they look relaxed, this might communicate that they are friends or they're familiar with each other. If somebody is acting very kind of stiff and professional and maybe is standing a little bit away from another person, not even making eye contact perhaps, it may indicate that they don't know each other as well. If both of the messages are consistent, the total message is strengthened. And we're going to talk about some examples of this coming up. If the messages are not consistent, a mixed message could be sent. So this is an example of a nonverbal message, which in the US usually indicates okay or good or all right. However, if you were to use this in other countries and make the assumption that it indicated the same thing, you would be very wrong. In Japan, it indicates money. Brazil, it would be insulting. And Russia, it means zero. So this A-OK in the US does not necessarily translate to other countries or other cultures, and this is just one of perhaps thousands of examples. Context of a conversation. So the affective and physical cues a speaker uses to indicate meaning, such as tone, facial expression, posture, and gestures. So where is this conversation happening? Are people happy? Are they sad? Are they smiling? Are they frowning? Are they angry? Are they standing up straight? Are they leaning? Are they sitting in a desk? Are they slouching? Where is this conversation happening? What are kind of the environmental circumstances surrounding it? We're going to talk about low context communication and high context communication. So low context communication is where the context, meaning the environment, the facial expressions, etc., is not as important as the actual words. So the words are more important than the context. So this is kind of ignoring, social relationships, ignoring environment, ignoring nonverbal cues, etc. And some examples of low context cultures include Western cultures, Swiss, and the Germans. High context communication is where the context of the message is very important, and in some circumstances is even more important than the actual words. So the words themselves are not necessarily that important. And some examples are Asians, Middle Eastern, and Native Americans. This can be a cause for confusion if people are communicating who come from different cultures and if their nonverbal cues don't match. For example, if somebody was doing that A-OK, but there weren't any words associated with it, or there were words, but the message was sending a different signal. Can cultures be both high context and low context? The answer to this is yes. And a good example is Mexicans. They have some instances where the context is more important, and they have other instances when the words are more important. Context can also vary depending on situations. So for example, if I am teaching a group of college students about spinach, the words that I use are probably going to be very important. However, if I'm teaching a group of elementary students about spinach, the words I use might not be as important, but maybe I'm going to sing a song about it, dance with it, play with it, eat it, paint a picture of it, and it will be more these nonverbal cues. So, relationships of individuals to groups can be determined by whether a culture is low or high context. In low context cultures, remember that's where the context of the communication is not as important as the words, people are individuals. In high context cultures, groups are really important, and people highly associate themselves with a group. An example of this for healthcare is with a high context culture, such as Koreans. They tend to be high context in this regards. When one of the members of the family is sick, as many members of the family as possible may attend the doctor's appointment. It would not be unlikely at all because that person is part of the group and not looked at as an individual. Uncertainty avoidance. So uncertainty avoidance is kind of what it sounds like, but it's avoiding things that are uncertain to you or things that are different from what you know. And some cultures have high levels of uncertainty avoidance, which you could almost look at as closed-minded, but it's not exactly that, where other cultures have lower levels of uncertainty avoidance. As far as food goes, cultures that have lower levels of uncertainty avoidance would be much more likely to try new foods and even new recipes because they're more curious, and within their culture, that curiosity is accepted as well as encouraged. Power, authority, and status. So power or perception of power can influence communication patterns. If you perceive somebody as more powerful than you or less powerful than you may talk to them in a different fashion depending on the context. In a low context culture, power is attributed to just a job, meaning if that person wasn't in that job, they would be equal to you. So there's more of an emphasis on equality. In a high context culture, there is more of an emphasis on authority. And so you would not question authority. And this I do see a lot in both nutrition and healthcare. I have many clients and have worked with many patients who ask a ton of questions and who do their own research and question my advice and question doctors' advice. And you know, there are pros and cons to each of these. I've also worked with patients who say, tell me what to do. You know, Corrine, as my dietitian, tell me what to do, or doctor, tell me what to do. And they don't want to do any decision making or, you know, research on their own. And so both of these are good and bad in some ways. They're just different, and that's the key. Gender roles. There are masculine and feminine cultures, and these can definitely influence cooking roles. Masculine cultures value power. They tend to be kind of more aggressive, potentially more task-oriented and materialistic. They may include Germany, Hong Kong, United States, depending, Italy, Japan, the Philippines, Mexico. Feminine cultures value quality of life and equality, and Denmark and Sweden are examples. And then also feminine versus masculine stereotypes with regards to health. As far as dietitians go, most dietitians are female. I don't know that there is an expectation for a dietitian to be female or male, but as it turns out, most are female. Female doctors are becoming more and more prevalent. However, this wasn't something that was commonly accepted, and in the beginning, females were actually not even allowed to attend medical school. And then male nurses are also becoming more and more common. However, this was something that was not a job for males in the past. Time perceptions. So different cultures perceive and interpret time differently, as you may or may not have experienced. There are monochronistic, mono means one, and polychronistic cultures. Poly means many. So this would kind of make sense. Monochronistic cultures focus on doing one thing before moving on to the next. And so monochronistic cultures, timing is very important for them, you know, schedules, agendas, being on time to appointments, etc. And generally these are for low context cultures. Polychronistic cultures might do many things simultaneously. Personal relationships may be excluded or not excluded. And so deadlines are a little bit more flexible. And courtesy and kindness are more important. And there are many different cultures that are polychronistic or monochronistic, and even a possibility to be both. I've traveled to Nicaragua quite a few times, and when we're in Nicaragua, we say, oh, they're on Nica time. Nica, Nica for just an abbreviation. We say they're on Nica time. So for example, there's a ferry that takes me from the mainland to an island that I go to, and there is a ferry schedule, which in the United States, most things like that do run on a printed schedule, but in Nica, it's Nica time. So yeah, the ferry says it's going to leave at 12, but it might leave at 11:50. More likely it's going to leave at 12:30, because it's just a different interpretation of time and the importance of time. Nonverbal communication is anything that is not said. So this could be looks that you give, how you're standing, your facial expression, etc. And so this can be just as meaningful as verbal communication in many instances, if not more meaningful. What is involved in nonverbal communication? Okay, kind of, I just said this, but touching, facial expression, gesture, posture, eye contact, spatial relationships, how close or far away are you to somebody else, and attitude. And so this is just an example of a little girl saying, Daddy, Daddy, look what I made. And the daddy's like, oh yeah, I'm listening, I'm listening. Or in a more realistic thing, the daddy might say, oh yeah, that looks great. And he hasn't even looked. So his verbal and nonverbal communication isn't matching up. An example with food is when somebody says, oh, why don't you try this food or try this food? And you try it, and perhaps it's something that they made, so you don't want to disappoint them. And you say, oh, yeah, it's really good. I really like it. But your face is saying otherwise. Maybe you're, cringing or gagging or kind of pursing your lips and trying to hold it down. Touch varies between cultures as far as what is expected and what's acceptable. Some examples, Orthodox Jews, it is not allowed to touch somebody other than a relative or somebody that you're married to. Latinos, touch is very informal and expected. And if somebody does not kind of return your touch, so hugs and kisses are very common, kisses on the cheeks, it might be looked at as, disrespectful. Chinese, you are not supposed to touch strangers, and males and females don't touch in public. So those are just some very, very different cultures where it would be important to be aware of another culture's kind of expectations before you touch somebody or before you not touch somebody. This can also change based on age, gender, etc. So for example, the type of touch that might be expected or accepted for the interaction between, an adult and a young child might be different than two adults. And in the US, we ban touch for the most part. There's all these sexual harassment laws, but these don't necessarily apply to children, say, children in a preschool or daycare, unless obviously they are truly sexual in nature. But it's okay to hug a child or give a child a high five or pat a child on the head. And a lot of the early research on touch is that touch and exchange of touch between cultures was actually a way to communicate peace, because languages weren't often identical. Gesture, facial expression, and posture. So when I first looked at this picture, I thought, oh, that's what some of my students look like. And I have some students that look like this, and I have some students that look like this. And yes, this does communicate something to me. Whether it's what the student is trying to communicate or not, I'm not sure. But we do all sorts of different gestures. We may cross our arms. We may say hello or goodbye using a wave. We may bow, we may shake hands, etc. And if our culture is doing a different gesture than another culture, there can be a lot of miscommunication. So for example, in the US, if you have your arms crossed, that might be kind of looked at as a negative thing. However, in the Middle East, this is very, very common when talking with friends. Thumbs up is considered good thing here. In Afghanistan, Australia, Nigeria, and the Middle East, it's actually considered obscene. And then nodding your head. Some cultures will shake their head side to side instead of up and down, and so this will be opposite from us. This is just a little cartoon with a person saying two different phrases, I'm sorry and thank you, and then their facial expression and how believable those words are going to be. And I would say, maybe this guy's believable, maybe this guy's believable, but maybe not so much this one. And then thank you, not so much. He doesn't look thankful. This one doesn't look thankful. This one doesn't really look thankful unless those are tears of joy. This one looks thankful. This one looks kind of not sure if they're thankful or not. And so nonverbal communication really can be just as meaningful or more meaningful than verbal communication. Eye contact. We talked about the evil eye already, and so some cultures it is acceptable to look at other people. Other cultures that would be offensive or even scary. In the US, we expect eye contact. However, staring is rude. So sometimes drawing the line between those two things is a little bit difficult. African Americans can be uncomfortable with eye contact. In the Philippines, it may indicate sexual interest. And then Asians and Latinos sometimes avoid it as well. Space. So I think of this as my bubble. And I think you've all been around somebody who is a little bit too close to you than you would like. And you're just kind of like feeling that they're really in your space and you feel like you have to back up, but sometimes they keep getting closer. And people have their own kind of definition of personal space, and it can be very different between people and cultures. Regardless of what that space is, when somebody is too close or too far away, it can reduce the ability to communicate effectively. Height of interactions is also important. This is something I do use a lot as a dietitian and when I've worked in the hospitals. A lot of times as a dietitian, my patients are seated, and in the hospitals, my patients have been in beds. And so if I stand over my seated patient and hover and talk to them, the message isn't that strong. However, if I pull up a chair or kneel down so that we're face to face, eye level, they're my equal, a lot of times that helps me build trust and improves listening with my clients. This can also be true with waiters and waitresses and restaurants. Some people like a waiter or waitress to stand above them at the table, and some people prefer when a waiter or waitress steps down and is eye level with them. Communication in healthcare. So a lot of times in healthcare, we rely on words. However, a good practitioner would try to rely on both. And this can create a lot of issues if people are not open-minded and or understanding of each culture. Practitioners may have different ideas about health, disease, and treatment versus patients, and so understanding and open communication is very important. If somebody feels insulted, they may reject the other person's stance. Providers and clients. So a provider is making the assumption that the client provides them accurate information. So if I'm the provider in a nutrition setting and I ask a client, well, what did you eat? Tell me what you ate the last 24 hours, or tell me what you ate the last 3 days. I'm assuming that they're going to tell me the truth. If they don't tell me the truth, I can't help them as accurately. But I do see this a lot in nutrition, and a lot of people will tell me what they think I wanted them to eat versus what they actually ate. And so this can cause a lot of understandings. What else is involved with communication? So confidence, caring, and trust. If somebody doesn't trust me, if somebody is not confident in my education or expertise, and if somebody doesn't sense that I actually care about them as a person versus just a number, they're not going to want to listen to what I have to say about nutrition. You see this all the time in nutrition as well as with doctors and nurses. If a patient feels that the doctor just treats them like a number, they don't feel as strong with the advice that that doctor gives them, and they're often going to get a second opinion. Barriers to communication. There are many barriers to communication. Nutrition related, there are some, but a lot of times this would be more medicine related. So if a person is in pain, they may have difficulty communicating. If a person doesn't understand medical terminology or even terminology related to parts of the body, body parts, the liver, the kidney, the appendix, the pancreas, like what are those? The red blood cells, the white blood cells, the immune cells, the antibodies. If a doctor is talking too medically, a patient might not understand. And if the patient is just not in a balanced place, maybe emotionally or socially, they might have difficulty explaining to the practitioner their concerns. Misunderstandings. So there are common misunderstandings, and you can read about these in your own. I am not going to be able to, or I am able, but I'm not going to force these on you. I'm not going to talk about these in much detail. Healthcare provider responsibilities. So I am a healthcare provider as a registered dietitian nutritionist, and anybody who works in healthcare would be, as a social worker, a nurse, a CNA, a dentist, a dental assistant, a doctor, a physical therapist, a psychiatrist, a psychologist, etc. So this could be many of you. It is our responsibility to try our best to understand what is said and to provide our clients or our patients with the best information needed to play a role in their own treatment. And this requires us to be familiar with cultural norms, listen carefully and seriously. So if we're working with a lot of people who may be from a different culture than our own, which is likely in this picture here, this practitioner should do some research ahead of time. Okay, where am I? What are these people's lives like? What are their concerns? What are their beliefs? What is normal for them? What is not normal? What is acceptable, etc. Intercultural accumulation and awareness. So there are some stages that people go through as they become more what's called competent of somebody's culture. And there's 4 steps, and I will explain them. Unconscious incompetence is when you misunderstand a communication in another culture, but you don't even realize that you're misunderstanding it. So you're unconsciously not understanding. You don't even know you've made a mistake. Conscious incompetence is when you do misunderstand, you're aware that you misunderstood, but you didn't make any effort to understand. So you were like, oh, yeah, I don't get that, but I don't care. I'm not going to learn about that. Conscious competence is when you are considerate of your own communication and you are doing whatever you can to learn about the other culture and have the best understanding possible, but you're having to work at it. You're having to research or ask questions. And then lastly, unconscious competence is when you are having a complete understanding and open communication with another culture and you're not having to work at it. It comes naturally to you based on perhaps years of experience. Successful intercultural communication. So there is a mnemonic for this, and a mnemonic is kind of an abbreviation of letters that can help you remember what key tips are for this. So C, consider culture. What culture is this person from? Anytime you're talking to them, what culture are they? Show respect. You should do this for anybody. Assess and affirm them. So say, you know what? I don't know a lot about that. Would you mind explaining it to me? Or, I'm not familiar with that food. What is it? Or how is it cooked? Sensitive. Be sensitive to issues that might be offensive, or cause untrust. And then demonstrate humility. If you make a mistake, take responsibility for that mistake, and go with it and say, I'm sorry, I didn't understand what that food was. Could you please tell me again? Or I'm sorry, I thought when you said this, you meant that, but you really didn't. So I would definitely know what this crash mnemonic is. Names. So names are a big thing in communication. How do you talk to somebody? What do you call somebody? Do you call them sir or madame or miss or mister or miss or sweetie or fella or son or dear? I have some patients who call me honey all the time. And I've had long relationships with these patients, not romantic, obviously. But I love these patients. They're like my grandparents. And so I don't mind that they call me honey, but that might not be appropriate for everybody. When I first started working with one of the nurses I work with, she calls everybody sweetie. And, I wasn't comfortable with that at first. I didn't know her at all. And I'm like, I'm not your sweetie. But the longer that I knew her, I was comfortable with this. So these might be acceptable during certain situations or in certain cultures, and they might not be acceptable in others. Name order can vary based on cultures. So in the US, we do first, middle, and last. Latin America, first, the woman's last name, day, and then the husband's last name. They don't always have the woman's last name in there, but often they do. In the Middle East, they use bin to indicate males and bint to indicate females, and this means of a place or son or daughter of. And so calling somebody by an inappropriate name can hinder communications as well as reduce trust. I always say it's best to start out formally, calling somebody Mr. or Mrs. or doctor or nurse or professor, and then have that person tell you, oh no, just call me Rose or just call me Corrine. That's okay. Appropriate language. So use common terms, use simple words, and then using commands. So for example, instead of using the word get, say purchase. As far as foods go, sometimes people say, oh, do you take that? Do you take sugar with your coffee? Would you take tea with your lunch? Will you take coffee with your breakfast? Instead of using the word take, say, would you eat that? Would you drink that? Because when people are learning a language, they're learning the verbs that mean what they mean versus alternative words that possibly mean that. Avoiding terms with multiple meanings. So for example, to address, this might mean to talk to a large audience, to address an envelope, or to ponder over an issue. And then avoiding slang words if possible. So ones related to sports would be dodge a bullet, strike out, you scored, run that by me one more time. Ones related to nutrition would be, easy as pie or icing on the cake or have your cake and eat it too. Or sweet as a sundae, things like that. So avoid those because a lot of times people won't understand what you're talking about if they're from a different culture than you. Have clients explain or summarize in their words what they think the conversation is about. And this is a big one for me. I work with a lot of Spanish-speaking clients, and my nutrition-related Spanish is decent, but as far as other Spanish goes, my conversations are pretty poor. And so I notice that if I'm not thinking about it and I say, oh, did you understand? Or did you eat that? Or did you take that med? Or are you okay with that? My clients usually say yes. But then if I ask them again later, or even the next time I see it, and I say, wait, we talked about that, I realized that they actually didn't understand. So having a client explain what they think you talked about can be really important. What was this diet that I recommended to you? What are you supposed to eat versus not eat, etc. Interpreters and intercultural communication. So in the United States, it is a civil right to be guaranteed equal access to healthcare, and we cannot discriminate based on language. And since we cannot discriminate, we have to provide interpretive services. From my personal experience, only larger cities and hospitals have physical people as interpreters, and smaller clinics and healthcare facilities generally use a telephone interpreter. This can be definitely helpful, but I will say in every hospital and facility I've worked at, we did have a telephone interpreter, but it wasn't easy to use. The phone wasn't always in the room. Sometimes the phone didn't work. Maybe the phone was a portable phone. The batteries weren't charged. The number was busy. The volume wasn't good, etc. When it did work, it worked fantastic, but it wasn't always easy. And people are lazy, and so they don't always do this. Non-professional interpreters, so sometimes people will use family members or just other staff members, but this can cause issues if people don't understand the medical terms. For example, if they don't understand, different body parts or different medicines or different procedures and they can't translate those correctly. It can also cause issues, say, if there's bad news. A daughter might not want to translate to their mother or father that they have cancer or that they need a certain procedure. So oftentimes things get lost in translation. I have some examples. 50% of the time, laxatives were missed as diarrhea, and swelling was confused with getting fat. And laxatives would actually give you diarrhea versus be diarrhea, and swelling and getting fat are very, very different. Counseling. So being effective as a counselor requires attitude, cultural knowledge, and good communication skills. And this is very true for nutrition education. I can't counsel somebody from a different culture than mine about what to eat and what not to eat if I don't understand that culture, understand foods that are acceptable to them, accessible to them, and normal for them, as well as understand values within that culture. In-depth interviewing can really help. So besides just as a nutrition example, what did you eat yesterday? Also ask, how old are you? Do you have enough money for food? Do you feel that foods affect your health? Are there certain foods that you eat for religious reasons, or are there certain foods you avoid for religious reasons? What was your education? Did you learn anything about food in your education? Are there any groups you affiliate yourself? Sexual orientation, I personally never asked that, nor political orientation, because that is not pertinent to me as a health practitioner, and I don't think would be important to most health practitioners unless it was possibly a psychologist, psychiatrist, and or endocrinologist, somebody who might be working with somebody going through like a gender transition or something like that. But nutrition related things, I don't need to know that at all. Questions. So what could you ask to learn about them? Some nutrition related ones. What do you eat to help cure your sickness or make it worse? Do you avoid certain foods to prevent sickness? Do you balance certain foods with other foods? Do you eat certain foods to stay healthy? What do you call this sickness? What name do you give it? What do you think caused it? What does it do to your body? What are you afraid of? What have you done that's helping, etc.? Nutrition assessments. So some common tools in nutrition assessments are things like a 24-hour recall, where you would ask somebody what they've eaten in the last 24 hours, a food frequency form where people would look at different foods such as apples, bananas, steak, chicken, rice, beans, bread, and they would say, I eat that twice a day, once a week, rarely, never, etc., or different nutrient databases such as the USDA. These are used, but there's problems because they don't always include cultural foods or cultural ingredients, and or if they do, the names don't always translate. So there are some cultural tools out there, but you just have to hunt for them. And you may have to create your own or just have the person write down what they've eaten. Intercultural nutrition assessment. I did kind of mention this, that cultural foods could be left out. If there are issues with reading or literacy or writing, you may have an interviewer fill out the survey, but they've done lots of studies where the results that an interviewer will record are different than the results that an individual would actually write if they were able to. Because being able to write something kind of in the comfort of your own home is different than having to actually tell somebody what you ate. And what I see a lot in nutrition is when clients have to tell me what they ate, they don't necessarily want to tell me the whole story, or the portions aren't accurate and they leave things out. But when they actually take time to record it themselves, they do a really good job. Not 100%, but pretty good. Education. So how do people like to learn? Some people like learning about nutrition one-on-one. Some people do better in groups because they can share stories or share recipes or share struggles and learn from one another. And this can vary based on culture, religious group, etc. And so you'll always have to evaluate how your nutrition education is working. if you can relate a health message to their survival, safety, or social needs, it will be most effective. So fundamental means, can they use it? Am I just telling them stuff to tell them about it? Or am I telling them something that's actually going to change their everyday life, make them live longer, live healthier, be safer, or fill a need within their life? So, maybe I've got a pregnant mom and I'm not going to tell her that she needs to eat healthy just because. I'm going to talk about her baby and the health of her baby, because that's very important. Things like that. Storytelling is a great way to convey messages. People like a lot of stories. Certain cultures. Look at influence channels. So influence channels are ways that messages get to an audience. So they may be like TV, magazines, newspapers, mail, internet, telephones, radio, etc. And different cultures prefer different things. African Americans, high rates of radio listening. Asian Americans watch TV, specifically Asian TV if it's available. And Latinos also like TV, both Spanish TV as well as English TV. So if you can find a channel that works towards those people, that will be really effective. And that is the end of the presentation. So I hope you enjoyed this presentation today, and I will see you next time.